Hi guys, welcome once again to the Online Digital Doctors, and this is the fifth episode of Online Digital Doctors. And today's episode is a Valentine special, and that's why we have very special guest with us on our dais. And even the topic what we have chosen for today is lung cancer, which somehow we have tried correlating it with the Valentine, because Valentine is all about love, and we say that you must protect your loved ones from the various diseases. And obviously, lung cancer is one of the primordial reason for lung cancer is smoking, and that's our agenda for today. So I welcome once again today the expert for the same, one of the leading Onco Surgeon of India, Dr. Durgatosh Pandey, the head of the Artemis Hospital for the Cancer, and I welcome him to with us on the dais. Once again, welcome, sir. So how are you doing, sir?
I'm good.
All right. So today's episode we have specifically kept on the Valentine special, and though the agenda is lung cancer, so very quickly, sir, if you can just throw some limelight on what exactly is the lung cancer.
So lung cancer is the commonest cause of cancer-related death, both in the whole world as well as specifically in India. Now, the main cause, the number one cause of lung cancer remains smoking, as rightly mentioned by you. 90% of all lung cancers are because of smoking.
Right.
They can be directly related to tobacco. Right. So, in a way, it is a completely preventable disease.
Absolutely.
Almost completely preventable disease.
Correct.
And smoking does not only affect the particular individual who smokes. It affects the entire family who is around them.
Right.
So at least on this Valentine Day, if the smokers can take a pledge
Right.
not to smoke in the future,
Right.
if not for themselves but for their own loved ones, because
Correct.
if they get a disease, the entire family suffers. Number
So-
one. Number two, the passive smoking affects the spouse, the children,
Right.
even the pets,
Correct.
even the child in the womb. It
Right.
affects everybody. So the
Right.
passive smoking is probably as bad as an active smoking. So if you
Right.
smoke and I do not smoke in this room, I'm equally affected.
Correct. Certainly
So
correct.
that would be my
Right. Super. Well said. Well said. So absolutely something very, very important, and as a very important piece of message he has already given in the beginning of the show, that yes, for our loved ones, because we are making them do the passive smoking, and we must stop this and take it as a pledge. So is it like, as you rightly mentioned, that 90% of the case is due to smoking? So how about that 10%? Is it like something inherited as well?
Not really. The lung cancers do not have much of an inherited reasons.
Okay.
Most of the reasons are environmental.
Okay.
So we say 90% is because of smoking. The other 10% we really do not know what causes it. There are things like asbestosis,
Okay.
that some industries which use asbestos and other things.
What is asbestosis, if you can simplify it?
Asbestos was previously used for ceiling, making the ceilings. and
All
roofs.
right. Okay.
And they are used for certain industries.
Okay.
And exposure to asbestos may cause lung cancer.
Right.
Then there are other reasons as well,
Mm-hmm.
like pollution itself. So
Correct.
just like smoking causes lung cancer, pollution itself also causes lung cancer.
Mhm.
And there are reasons which we do not know.
All right.
So among those reasons, and most of these lung cancers which are not caused by smoking
Mm-hmm.
are things like adenocarcinomas or bronchoalveolar carcinomas. These are technical terms
Right.
which may have a little more predisposition in females than in males.
Okay. All right. So this is something, so we can say it's not exactly inherited, but there are few reasons which are still yet to be
Yes.
folded, I would say.
Yes.
Okay. And is there any various categories of how many types of lung cancer prevails as of now?
So we generally classify lung cancers into first a primary lung cancer and a secondary lung tumor. Secondary becomes cancer is somewhere else and it has spread to the lung.
Okay.
So right now we are not talking about the secondary lung tumors which
Right.
are coming from, let's say, sarcoma or some other places.
Okay.
Now the primary lung cancer is generally classified on the basis of what they see under the microscope,
All right.
on the biopsy. Why it is done so? Because even the treatment varies. So it is a small cell lung cancer and a non-small cell lung cancer. What is not a small cell lung cancer is a non-small cell lung cancer.
Okay.
A small cell lung cancer hardly ever presents at a situation where surgery would be possible.
Okay.
Surgery is indicated in very small category of small cell lung cancer.
Right.
Most of these patients are treated with chemotherapy, plus minus radiotherapy. They are extremely aggressive tumors, and the survival on an average is weeks to months
Okay.
for small cell lung cancer.
Right.
In non-small cell lung cancer, we have more options for treatment, including all surgery, chemotherapy, radiotherapy, depending on the stage at which the patient presents.
Okay.
And the non-small cell lung cancer predominantly would be either squamous carcinomas or adenocarcinomas.
All right. Okay. So when it comes to how we can say that it is like we discussed in the very first episode when we were talking about when you discussed few important points about the various stages of cancer. So the same it applies to the lung as well.
Yes. So the staging of cancer is applicable to all kinds of cancers,
Okay.
and lung is no different. So in lung cancer, we again have stage 1 to stage 4.
Right.
And as I said in the beginning, in the previous episode also, that the challenge is to find the cases in stage 1 and 2.
It's difficult.
And we do not find so many cases in stage 1 and 2. Most of our patients would present in stage 3 and 4, where cure would be a little more difficult
All right.
than in earlier stages. So if the patient presents in stage 1 and 2, they can be very effectively cured by surgery.
Correct.
Right? And in certain cases, chemotherapy may be required after the surgery.
Right.
In stage 3, we divide them into 3A and 3B. Up till 3A, we can consider that patient gets chemotherapy and then we operate,
Right.
and then gets further chemotherapy. 3B, we cannot operate.
Okay. I would just like to intervene here. If you can just drill it down, because this is what we have been receiving from our viewers. Though this treatment is very common, but if you can simplify in a very layman that what exactly is done and what is chemotherapy? What exactly is done in chemotherapy?
Chemotherapy is basically a chemical treatment for cancer.
Okay.
So they are drugs. Chemical treatment means they are drugs.
Right.
So these are medicines. Generally, they are injectable medicines.
Right.
Nowadays, there are oral medicines which are also available.
Uh-huh.
And these chemotherapeutic drugs, when they go into the bloodstream, they act on rapidly dividing cells. The
Okay.
cells which are dividing rapidly, haphazardly. Cancer cells divide at a very rapid pace.
Right.
And therefore, these chemotherapeutic drugs try to address those cancer cells which are dividing at a rapid pace.
The one.
This is the principle behind the tumor. Then it works on a log cell kill basis. These are technical things, which means that, for example, a particular chemotherapeutic drug kills 90% of all the cancer cells in
Right.
one go. So 10% will be left behind.
Right.
Then in the next cycle it kills another 90%, which means 1% should be left behind.
Okay.
In the meantime, some more proliferation would have occurred.
So what was the tentative duration of this chemotherapy in which we can
Generally,
say?
it is about 3 weeks.
Acha, 3 weeks.
3 week, the chemotherapy, there are several regimens, but generally chemotherapy is given at 3 weekly intervals. Because it also affects all the rapidly dividing cells, so it would also act on bone marrow cells,
Okay.
which are producing blood cells.
Right.
Because it is also rapidly dividing
Absolutely.
cells. It acts on the cells within the gastrointestinal tract,
Okay.
because they are also rapidly dividing. And because of this, we allow so much time for these bone marrow and other areas to recover.
Right.
And that takes about 21 days to
Okay.
recover completely, and then we give another shot of chemotherapy.
And what is the total duration of the chemotherapy course in which we can certainly say that yes, we can get the patient treated through chemotherapy?
So, we have to understand that chemotherapy is not the cure for lung cancer. the primary treatment of lung cancer at an early stage, or at least up to 3A, is surgery.
Okay.
So unless the disease can be physically removed from the body, it is not curable.
Perfect. So there is a likely possibility that can backfire.
Yes. So why do we give chemotherapy then after removing the disease? Because based on certain criteria which we see on pathological examination of the specimen that we remove,
Correct.
we calculate that there is this much percentage of chance that this tumor might come back.
Right.
Okay. And for preventing further recurrences,
Mm-hmm.
chemotherapy is added, and
Alright.
at times radiotherapy as well.
All
But
right.
the primary treatment at a curative stage
Surgery.
still remains a surgical resection.
All right. Perfect. So it's like the early stage or the advanced, preferably what the permanent solution is the surgery.
Yeah. Unfortunately, surgery cannot be done at an advanced stage.
Right.
As I mentioned, surgery would be applicable for stage 1, 2 and 3A.
Correct.
1 and 2, direct surgery,
Right.
and 3A after chemotherapy, surgery after chemotherapy.
Okay.
From 3B onward, surgery is not an option,
Okay.
generally.
Yeah. Right.
So 3B is treated with a combination of chemotherapy and radiotherapy.
Okay. And what is radiotherapy?
Radiotherapy is just like an X-ray.
Okay.
So when you get an X-ray done, so it is a diagnostic radiology.
Okay.
Radiotherapy is giving a higher dose of the same X-ray
Right.
in order to kill again the rapidly dividing cells in that area.
Okay.
So that is radiotherapy.
Right. And is there any standardized criteria where we can say a patient is in a stage of 1, 2, 3A, 3B? As in let me put my question like this. For example, there are two doctors and one say that a person is in 3A, the second says in 3B. So it's like, is it more on the base of the experience or there is some standardization?
There is an objectivity to it.
Okay.
It's not like it is completely subjective. There might be an element of subjectivity.
Okay.
But more or less, it is an objective criteria.
Okay.
There are fixed parameters that this is stage 1, this is stage 2, this is stage 3A, 3B, 4. Right?
Alright.
And because they are so technical, so I would not be mentioning these things
Correct.
right here now. And then there is another caveat to it.
Okay.
If there is a doubt
Mm-hmm.
as to what stage it belongs,
Mm-hmm.
then treat it as a lower stage.
Okay. Okay.
So that is a caveat to it. This is the internationally accepted recommendation.
Uh-huh.
For example, if there is a stage 3A versus 3B,
Mhm.
there is still some nagging doubt
Mhm.
in our mind. We will treat that patient as 3A and accept a few percentage of error.
Mhm.
Why? Because if we treat them as 3B and they are actually 3A, we are denying them as curative surgery.
Right. Correct.
So that is the philosophy behind treating
Perfect.
them at a lower stage.
Right. Very nice. And something this is because what I have been hearing in the masses and in the sphere about you. If you can just let me know, because what happens, we have generally I have keep on getting this feedback from various people and even in various sphere of media that specifically you have a very advanced expertise in second level decision making. So my question as a general person that clicks my mind is, when a patient has already come from one doctor and it comes to you, as you rightly mentioned, that the stages are something very objective. So 99% someone was already figured it out that it's 3A, so obviously it's 3A. So what's that particular thing which makes your second decision making at a second level very powerful, and that becomes in most of the cases successful for the patients and they get through and you are able to make them safe from the cancer? What's that particular factor?
So it is a combination of analytical reasoning and intuition.
Okay, intuition. All right.
Intuition as well. For example,
As a doctor,
it is. For example, I'll just give you an example of a patient who just got admitted today.
Okay.
So this patient had some disease in the chest and had some fluid inside the chest.
All right.
So he was being treated as tuberculosis. They had
Okay.
aspirated that, they had taken out the fluid from the chest and they found no tuberculosis and no cancer.
Okay.
And because tuberculosis is so prevalent, it was being treated as tuberculosis.
Right.
Now he takes the drugs for tuberculosis for a month,
Mm-hmm.
and then somebody tells him about visiting me, and then he comes to me, and I decide to do a biopsy.
Okay.
When I do a biopsy, it is cancer.
Okay. Okay.
Now that is one part. Now the diagnosis has changed from tuberculosis to cancer.
Right.
Then now staging. Now
Correct.
suppose that fluid is positive for cancer,
Uh-huh.
it becomes stage 4.
Acha.
If that fluid is negative for cancer, it is stage 2.
So what do you mean by positive for cancer, negative for cancer?
Because there is a mass in the lung,
Okay.
and the lung is surrounded in the thoracic cavity, in the cavity of the chest by
Right.
pleura.
Right.
So between the lung and the pleura, the chest wall, there is hardly any fluid in normal individuals.
Okay.
Very small amount.
Okay.
If a fluid gets accumulated,
Right.
then we always become suspicious that there is a seeding of this cancer into the chest wall pleura,
Okay.
which makes it stage 4.
Okay. Which makes it positive for.
Yes. So
Right.
once you take out the fluid by a needle
Right.
and subject it to microscopy, you might find cancer cells there.
Right.
You may not find also.
Correct.
Now sometimes when you find cancer cells, it becomes stage 4. You do not find cancer cells, it doesn't mean that it doesn't exist.
Right.
So mostly what people do is when they find such fluid,
Uh-huh.
they will label it as stage 4 regardless of whether the cancer cells are seen or not.
Okay.
And 90% of times they are right.
Correct.
It is that 10%
Uh-huh.
where there is an error, where this intuition comes in. So what happens is you have to look at the entire picture. There is a tumor in the lung, it is obstructing the airway.
Uh-huh.
There is a collapse of the airway.
Right.
The lung shrinks in that area, and that shrunk space is filled by fluid.
Okay.
It need not necessarily be malignant, that fluid.
Okay.
So you have to think accordingly. So you start the patient on antibiotics, give something to expand the lung,
Mm-hmm.
and then see if the fluid persists or not.
All right.
If the fluid has gone, it is stage 2.
Correct.
So even in the staging, and that directly impacts on the treatment.
Right.
So as I said, it's a combination. Sometimes I accept. It's not always that I will change their decision making.
Right.
It will be in only, let's say, 5 to 10% of patients
Correct.
in whom the decision will be changed.
But as you rightly say, I personally would like to say that, as you said, that why you said that 10% is the intuition, and then you have to see as a particular case all those criterias. So certainly it is something you are again being very logical, but in a very subtle way, observing it holistically.
So what is intuition?
Mm-hmm.
Intuition is something which comes to us reflexly because of our training.
Correct.
It is not something that it's coming out of the blue.
Absolutely.
Now, we have been trained and we have read and we have observed so many, experienced so many things, and because they get accumulated in
Right.
our subconscious level,
Correct.
that becomes an intuition.
Perfect.
It comes out.
Right.
You may not be able to explain it completely,
Very-
but that will give you
Correct.
a voice from the subconscious.
Right.
Yes.
So that's something which makes you very, very specific in second level of decision making. All right, very nice. It was superb. You have just made it so simplified in such a simplified manner. Now, what we have been seeing generally, as you even mentioned in your very first episode when it was a very general overview, and obviously in the upcoming episode, likewise today we are taking it the lung cancer, we will be definitely coming on to the breast cancer as well. So breast cancer is something which is obviously for the women, but lung cancer, what we earlier, if we talk about, start off somewhere around 80s, 70s, 80s and 90s. So that has been prevalent in males, not female. But now what we are able to see, the rate is going high in female. So what are the possible reasons for it?
So, predominantly there are two reasons to it.
Uh-huh.
One is that we know that lung cancer is directly related to smoking.
Correct.
So previously, let's say we are talking about 50 years or 60 years
Right.
back, most of the smokers were men.
Correct.
Men used to smoke, the women hardly used to smoke.
Absolutely.
Now it all started changing with more liberty to women, feminism, which is all good.
Right.
But then there is another aspect to it,
Mhm.
that women started taking cigarette,
Correct.
right? They started smoking. In the meantime, what happened, this awareness about lung cancer and smoking, this correlation was becoming established.
Okay.
And the men started early, plateaued early, and now there is a decline.
Okay.
The women started late,
Right.
have not yet plateaued.
Right.
So the number of women smokers continue to rise as we speak.
Okay.
The male smokers have plateaued or are declining, depending on the country which we live.
Right.
So that's the reason why in women the lung cancer starts increasing. Secondly, as I mentioned, 10% of lung cancers are not related to tobacco,
Correct.
are not related to smoking.
Right.
And some of these lung cancers have a predisposition to women.
Okay.
So as the percentage of smoking related lung cancer decreases, automatically the percentage of non-smoking related lung
Correct.
cancer
That will increase. Correct. Right. So, if we take the male and female, so is it like in both the cases, what has been experienced by you? Is there any difference in the complication or cases are same? As in, like, as you rightly mentioned, the categories of lung cancer. So have we seen that same kind of cases are being in women and men, or it's like the case of men is different from the women? What's arising?
I would not say men and women have different kind of cancers.
Okay.
It is smoking related cancers and non-smoking related.
All
cancers.
right.
Women have a little more percentage of non-smoking related cancers.
Okay.
So they have tumors which are peripheral in the lung more often.
Right.
Men will more often have the smokers. The
Right.
smokers would have more often central tumors.
Okay.
Right. Although it may vary. And
Central to the lung.
central in the lung. So the lung in the center of the lung.
Got
So
it.
they may be a little more difficult to surgically resect.
Right.
And may require a larger amount of lung resection.
Okay.
And the not women, but non-smoking related lung cancers may have a more smaller lung resections or similar sized tumors.
Right.
And women are more likely to have a non-smoking related lung cancer. than a
Right.
smoking related.
Right. So it's like in surgery, as you mentioned, we remove that, basically the tumor part. Is that what we do?
Not just that. In surgery, there are principles of surgery. So if it is a primary lung cancer, and this patient is undergoing surgery, we have to remove a lobe of the lung.
Okay.
So right lung has 3 lobes,
Okay.
left lung has 2 lobes.
Okay.
So we try to remove a lobe of the lung which contains the cancer.
Right.
Anything less than removing a lobe of the lung is probably associated with increased risk of recurrence.
Okay.
Although for very small tumors,
Right.
even less than lobe resections is also acceptable nowadays.
Right.
In certain central tumors or in very big tumors, this patient may require removal of the entire lung on one side.
Correct.
Right. So our aim is to preserve the lung
Right.
and remove only a lobe,
Correct.
whereas in certain patients we
The
may
lung has
need
to be removed.
need to remove the entire lung.
Right.
Plus, the second aspect to surgery is the clearance of all the lymph nodes within that area of the chest, which is
Okay.
called a mediastinal lymph node dissection.
Okay.
So these are the 2 things
Right.
to surgery.
Actually, my question was asking of this is something you have given something to a very small question. You have already made many things which might have popped up in my mind, but one thing which I want to extend as a question. So today, what we are seeing that organ transplantation is very, very common. So my question, my reason for putting up that question was: is there any feasibility that where we are looking forward that this lung is gone completely? So let's take out the lung and we are looking forward for an organ replacement. Is there any
It
feasibility?
has not yet come for lung cancer.
It
It has come for liver tumors,
Okay.
but not for lung cancer.
Okay.
Now, for the reasons are there. For transplantation, the organ is a very valuable thing.
Right.
There are many people who would require lung transplantation.
Right.
And we have to choose those individuals who are likely to live for a longer period of time,
Okay.
right?
Correct.
So we choose those individuals and prefer to give those organs to those individuals,
Right.
rather than wasting them for
I got it.
patients who are not likely to survive for a very long time.
Right.
Plus, there has to be no alternative treatment.
As in?
For transplantation,
Uh-huh.
where is the lung transplant effective? In an end-stage lung disease like we call it chronic obstructive pulmonary disease, bronchitis, emphysema,
Correct.
these kind of
Correct.
diseases, which goes in an end stage where
Right.
you do not have
Any option.
The patient has either to die of the disease
Right.
or receive the lung transplant.
Right.
Here we have options
Okay.
in early stages. We do a lobectomy or remove the entire lung,
Right.
and one lung can function quite adequately.
Right.
1.5 lungs can function quite
Correct.
adequately. In case of more advanced disease, there is
Both
simply
the
no
lungs.
point. No point because the prognosis of this individual is not good. This
Okay.
patient is not likely to live for a long time,
Right.
so why waste an organ on him?
Okay.
So that's the reason why lung transplant is not generally used for tumors.
But feasible, is it feasible?
Technically it is feasible.
Technically
it is feasible.
Is it done till date or it's not done? It has not been tried.
No,
Okay.
ethically it would be questioned, and it is, I think.
Why ethically it would be questioned? Just because of this reason only?
Yes, just because of
So, but don't you think so this applies in others also, heart?
it does. Heart it is not done for the tumors.
Okay.
Heart it is done again for
Theek.
an end stage cardiac disease where no other option is available. So
Right.
it would not be done for a
Mhm.
heart attack. For a myocardial infarction, heart transplant would not be done.
So for heart attack, heart transplant would
No.
Acha, okay.
The treatment for heart attack would be revascularization, which means either stenting or surgery,
Okay.
bypass surgery.
Alright.
It is only when the muscles of the heart are not active.
Alright.
So
It's weak now.
So they are so weak that no amount of revascularization and other things
Okay.
is likely to reverse that.
Alright.
It is only then that is chronic stage the heart failure
Very
that
nice.
a heart transplant would be required.
Oh.
Similarly, liver.
Okay.
So in liver, what we do is, let's say hepatitis B or C related cirrhosis.
Mm-hmm.
So now that cirrhosis has become so bad
Correct.
that liver cannot function. So
Right.
you need a new liver.
Right.
Transplant is an option. Now the cirrhosis itself gives rise to tumors.
Correct.
So the tumor there is an incidental thing,
Right.
and therefore you do transplants for tumors.
Correct. Absolutely. Very nice. And how are the symptoms for the lung cancer?
So the symptoms for lung cancer is one, either blood in the sputum,
Okay.
right? A nagging cough which does not
Okay.
go,
Right.
right? And an unexplained weight loss.
Okay.
So these are the three most important symptoms.
Are they same in male and female?
Yes, yes,
Same. Okay.
So if these symptoms are there,
Uh-huh.
then one must look into a possibility of lung cancer.
Okay, they must go. And it's like, as you rightly said, that nagging cough, like for how much time if it's still
So
prevails?
2 weeks is a good time for any kind of treatment to be effective. For example,
Okay.
there is an infection and there is a
Right.
cough,
Right.
even tuberculosis. 2 to 3 weeks of treatment should be enough for the patient to feel better.
Right.
If the patient doesn't feel better and the cough is increasing,
Right.
there is sputum which is blood tinged,
Right.
then one must investigate for a possibility of lung cancer.
Perfect, right. Very nice, sir. You have already given us a very good and very good insights on lung cancer. And as we are just on the conclusion of the program, one single master tip for all our viewers, the ones who are actually suffering from lung cancer. What you would advise them?
For people who are not suffering first,
Right.
and you are smoking, who are likely to suffer from lung cancer,
Okay, all right.
please stop smoking. Right?
All right.
Because 90% of lung cancer again is because of smoking.
Right,
For patients who are suffering from lung cancer, we have options
right,
of treatment. Depending on your stage, we have options of treatment.
correct.
Now, fortunately, if you are in stage 1 and 2, it is a highly curable disease.
Right,
Lung cancer, it is said to be a killer, but in stage 1 and 2, it's a highly curable disease.
right,
In stage 3A, the cure rate decreases, but still it is curable with a good surgery and radiation, chemotherapy, etc.
right,
Stage 4, there has been a lot of progress
correct.
in terms of chemotherapy,
Mhm.
and more than chemotherapy nowadays, targeted therapy.
Mm-hmm.
So if we have, let's say, an adenocarcinoma of the lung,
Mm-hmm.
the biopsy goes for some kind of molecular testing,
Right.
and we try to suppress that target by
Correct.
giving some tablets.
Right.
So I have seen patients with stage 4 lung cancer, not many, but a few patients with stage 4 lung cancer living for 4-5 years
Oh
with
my
that
goodness.
tablet. So,
But in that
nowadays,
case, only tablet is the option, or we can go for other ways as well.
the chemotherapy
Chemo and
those
radiology,
yes.
yes.
Chemotherapy and those targeted therapies.
Okay.
So, as I say, that even for higher stages of lung cancer, there have been improvements in treatment.
Okay.
And this improvement continues to take place as
Right.
research goes on.
Right.
And so all is not lost.
Okay.
Stage 1 and 2 highly curable.
Right.
Stage 3 and 4 progress is being made consistently.
Correct. Perfect. Thank you so very much, sir. You have already shared super valuable information on the same. And here we are about to conclude the program, and it was a fantastic piece of information and knowledge that has been shared by Dr. Durgatosh Pandey. And to all my viewers, I would request you, whatever questions you have related to the lung cancer, just post your questions right away in the comment section on the live which is going on. And in the next episode, we will be going to initially 10 minutes, he will going to address all your questions, and obviously from the next to next episode we will be inviting the live call in the studio as well. So please, if you have any question, anything that has still is a question for you and that has not been answered by him because of the limited time, please do post your question in the comment section, and that will be addressed in the next episode. And thank you so very much for watching the episode, for watching the show. And I once again request each and every single viewer that our vision and our agenda for online digital doctors is to manifest the knowledge and the experience of the top doctors of the Asia and India across pan-India level, so that every single person must be benefited from their knowledge. Because obviously if you are the sufferer, then you understand the pain for it. So please, just for the sake of others, for the sake of humanity, please do share it, do like it, do comment it. We are ready. Please do post your suggestions, because we look forward for further improvisation. Once again, thank you so very much, and I really love you guys. I'll catch you guys in the next episode, and please stay tuned for the update for the next episode. Thank you so very much. Bye bye, take care, good night, Shubhratri, Shabba Khair.
Thank you.